Have you ever stopped to think about how your body is actually run? I mean, really run. We have these two incredible command centers working 24/7 to keep the whole show on the road. Today, we're going to look at how these totally different systems work together to handle everything from that donut you had for breakfast to a split-second emergency. So let's get into it.
Seriously, just think about that number for a second. 30 trillion cells. That's like being the CEO of a company with 30 trillion employees. How on earth do you keep a system that complex from just falling into complete chaos? Well, it turns out there isn't just one boss in charge. There are two, and they have completely different ways of managing things.
And here they are, our two managers. On one side, you've got the endocrine system. You can think of this one as the company's strategic planner. It sends out chemical memos, we call them hormones, to guide the big picture stuff like growth and metabolism. It's all about the long game, slow and steady. But then you've got the nervous system. This is your rapid response crisis team. It doesn't send memos, it sends instant electrical commands for immediate action. Fast, direct, and always ready for an emergency.
So first up, let's take a closer look at that chemical command center. We're going to see how this slow and steady planner uses hormones to manage the body's pressure over the long haul.
So what is it really? Well, the endocrine system is basically a whole network of glands that make and release these hormones right into your bloodstream. These hormones are like little messages that travel all over your body to keep everything in balance, a stable internal state that scientists call homeostasis. It's this beautifully complicated dance of regulation that's happening all the time.
And here's a perfect everyday example of this in action. Managing your blood sugar. Let's say you eat a meal. Your blood starts to fill up with glucose, which is sugar. In response, your pancreas releases insulin. Now, insulin is basically the key that unlocks your cells, letting all that glucose in so it can be used for energy. As your cells soak up the glucose, your blood sugar levels go right back to normal. Kinda elegant, right?
That whole cycle is all about keeping things in balance. But what happens when that chemical messaging system gets wires crossed and that delicate balance is completely lost?
Well, you end up in one of two critical states. With hyperglycemia, or high blood sugar, there's not enough insulin to unlock the cells. So you've got all this fuel floating around in the blood, but the cells themselves are literally starving. On the flip side, you have hypoglycemia, or low blood sugar. This means there just isn't enough fuel in the blood to begin with, and that is an immediate crisis for your body.
And when you have hypoglycemia, your body starts sending out some pretty clear warning signs. In fact, medical pros use a really simple mnemonic to remember them. HE's tired. It stands for headache, excessive hunger, sweating, tachycardia, which is just a fast heart rate, irritability, restlessness, exhaustion, and dizziness. It's your body's alarm system basically screaming that it needs fuel right now.
Okay, so we've talked about the slow chemical memos. Now it's time to shift gears and jump onto the electrical superhighway. Let's check out our second command center, the nervous system, where signals travel at lightning speed.
You know, the nervous system doesn't have time to wait around for a memo to be delivered. Think about it. When you touch a hot stove, you don't get a hormone that politely suggests you move your hand in a few minutes. No way. You get an instantaneous electrical command that zips up your spine to your brain and back down to your muscles in a tiny fraction of a second. It is all about immediate action and reaction.
But because this whole system is so incredibly fast and direct, when it fails, that failure is just as dramatic and catastrophic. So what happens when this electrical superhighway gets, well, when it gets cut?
Well, the results of a spinal cord injury are just devastating, and they depend entirely on where that break happens. An injury high up in the neck, at the C4 vertebra, can lead to tetraplegia, that's paralysis of all four limbs. If the injury is a bit lower down, say at T6 in the chest area, it causes paraplegia, which is paralysis from the chest down, and one at L1 causes paralysis below the waist. The higher up the damage on this superhighway, the more of the body is completely cut off from communication.
So, when we look at how these two systems break down, it's fascinating. Their failures are as different as their day jobs. It's really a story of a slow, chronic failure versus a sudden, acute catastrophe.
And this brings us to a really crucial point, which is perfectly shown by diabetes, a classic failure of the endocrine system. With type 1, the body's own immune system attacks and destroys the cells that make insulin. So you have basically no insulin at all. In type 2, the body's cells start ignoring insulin, or the pancreas just can't keep up with demand. So you see, they're both failures of the same system, but they happen for fundamentally different reasons, and usually over a very long time. Now, compare that slow burn to a nervous system failure. Like this quote says, with a spinal cord injury, the effect will be lower than the point of where the injury is. It's immediate, it's physical, and it's localized. The signal just stops. It's not a slow breakdown of the whole system, it's a complete and sudden communication cutoff. So when the body's own internal managers just can't do the job anymore, whether it's from a slow decline or a sudden break, that's when people on the outside, professionals like nurses, have to step in and manage the crisis. And they don't just wing it. They use a really structured approach called the nursing process. It's this 5-step model where first they recognize cues, like those "he's tired" symptoms of low blood sugar. Then they analyze those cues to figure out the problem. From there, they generate solutions, take action, and finally, they evaluate whether what they did actually worked. It's a very methodical way to intervene when the body's own systems are failing. And for someone with diabetes, for instance, that take action step is huge. It involves a whole range of things. It's not just about giving some insulin. It's about constantly monitoring blood sugar, teaching the patient about everything from diet and exercise to daily foot care, and really empowering that person to manage their own internal environment every single day.
You know, all of this really brings us full circle, right back to where we started. These two systems, these two internal CEOs, are performing an unbelievably delicate balancing act every single moment of your life.
It's honestly just amazing when you think about it. The long-term strategic planning of your hormones and the split-second crisis management of your nerves are constantly working in concert, in perfect harmony. They're the reason you can grow and eat and think and run and heal all at the same time. This whole process is like a constant, silent ballet keeping us alive. And the failures we talked about, well, that's what happens when the music stops. It really makes you wonder, doesn't it? What other incredible conversations are happening inside our bodies right now that we don't even know about? And just imagine what we could do if we learned to listen to them even closer.